Dr. Philip Stieg, Professor and Chairman, Department of Neurological Surgery, Weill Cornell Brain and Spine Center, Weill Cornell Medicine, New York Presbyterian Hospital.
Dr. Stieg, we're talking today about marijuana. What is it, if you would explain, about marijuana that makes it affect the brain in the way it does?
Well, it's interesting. It turns out that there are plant forms of marijuana that stimulate the brain, and also our human bodies create something like marijuana as well, and they're called, the plant form is called phytocannabinoids, and the body form is endocannabinoids, and there are specific receptors in different parts of our body. So when you take in an external form of marijuana, cannabis, it stimulates these receptors, number one, and number two, it also has an impact on the transmission of our normal neurotransmitters, which again affects the way your brain works.
It also has an impact on other parts of the body.
Absolutely. Like I said, there are two types of receptors. The CB1 receptor is predominantly seen in the central nervous system, but we also see that in connective tissue, your reproductive organs. And then the CB2 receptor is more commonly seen in your immune system. So there are a lot of receptors in the spleen and the liver, but there are also receptors in the blood vessels, heart and kidneys. And hence the effects that one sees on someone that is using marijuana in one of the forms.
What are your thoughts on the use of marijuana for medicinal purposes? What are the circumstances in which it would be most effective?
Well, as you know, this is an extremely controversial topic right now. There's both the legal aspects. It's surprisingly 29 out of the 50 states have legalized marijuana, and then there's D.C. as well. There is some good data that it is of benefit, and I'm not talking about the herbal form, but you know, the types that we use medicinally come in a vaporizer, a pill, or a sublingual form that you can put underneath your tongue. And in those forms, it's been shown to be of benefit to patients that have neuropathic pain, chronic pain syndromes, and some kind of radicular pain. There have been suggestions that it may be of benefit in other problems like movement disorders, like Parkinson's disease, and even suggestions that it may help with post-traumatic stress disorder. Amazingly enough, there isn't an incredible body of research on this, nor is there any really good literature on the long-term effects of cannabis. So I think that if it benefits a patient, certainly in patients that I think have terminal chronic cancer pain, would be a very reasonable use. And in patients that have this terrible, intractable nerve pain, say related to diabetes or things like that, it would be a reasonable thing for a physician to monitor and work with the patient.
A lot of people lump both alcohol and marijuana together recreationally. As somebody who has spent much of your career studying the brain, how are those two substances alike, would you say, and how do they differ?
Again, it's a matter of degrees. Obviously, alcohol, if you have one or two drinks, can be a stimulant, and then when you get beyond that point, it becomes a depressant. The mechanism of metabolism for alcohol is completely different. It's metabolized in the liver, and it's the breakdown products that can have secondary effects on your brain, whereas marijuana is a direct stimulant by activating those receptors that I talked about in your brain. The effects, however, with smoking and you use it in some excess, it's going to affect your memory. It's going to affect your coordination and motor function. So again, the extreme use of both will manifest itself in similar ways, but socially they can both be used to achieve the same kind of goal. There aren't a lot of great medicinal factors that one can associate with alcohol or excessive alcohol consumption.
Are there certain people who really should avoid medicinal or recreational marijuana?
The amazing thing is that there's, to my knowledge, it's not been reported that one can overdose with marijuana. That being said, if a person has cognitive disability, memory disabilities, I would certainly think twice about wanting to use cannabis as an agent to help them.
Anything you want to add that I didn't ask you about, or any of your thoughts on marijuana?
The key thing to understand here is that it's for as long as it's been around and as long as we've talked about it, I find it surprising about the limited body of really good literature on its effects. I also believe strongly that we don't want farms and just people going out and getting marijuana. I wouldn't agree with that. I think for medical use, it should be used under the guidance of a licensed physician that has a reasoned and rational approach towards the problem.